to today's episode of Health Tips with Nurse Angie on your favorite program, Let's Fix It. Today, I'll be running up on blood pressure and its management. Previously in my videos, I've done hypertension and its management, hypotension and its management. Today, I'll show you how to measure blood pressure and interpret the reading. But before I do that, I'll have to explain to you some factors that can affect the blood pressure reading while you take it at home. So many factors can affect your blood pressure reading, but I'll just mention a few. Number one, activities or exercise. If you take your blood pressure measurement after an exercise or an activity, you might have a wrong reading because the heart rate must have increased. The next one is food. Food consumption can affect your blood pressure. It can lower the blood pressure. So if you want to take the blood pressure measurement, it should be either in the morning before you eat or 30 minutes after eating. The next one is alcohol or drug consumption. Do not take alcohol or any hard drug before measuring your blood pressure. Another factor that can affect the blood pressure measurement is positioning. If you want to take your blood pressure, ensure you are in a relaxed position and your hand flexed properly on so that you can get the accurate reading. Stress can also affect the blood pressure reading. So if you're stressed out, do not be in a hurry to take the blood pressure. Be in a relaxed position, or you must have taken enough rest, after which you can then measure your blood pressure. So I will show you right now how to measure the blood pressure. When you want to measure your blood pressure, ensure that you use the accurate cuff size. And also, do not place the cuff on your clothing like your shirt. You have to roll up the sleeve of your clothing so that you have the cuff directly on your skin. Now we have the electronic and we have the manual. For you that is not a non-medical practitioner, it is advisable for you to use the electronic because you have a result that you can interpret. This is the blood pressure measurement equipment. You have the battery in here. This is how it is. You have this. This is the cuff. And this is the meter. So this is how it is. This is the cuff. You have to open the cuff to the normal arm size. This is how it is. This is the tubing back, the battery space at the back. You open it, you fix in the battery behind, fix in the battery behind, and it comes on. On this side, at the side, you see where you have to fix in this tubing here like this. Roll your sleeve. You have to roll your sleeve, the sleeve of your shirt, so you can have access, enough space on your arm. You go this way. This is how it is. How to do it yourself. Now, like I said, positioning. Standing while measuring your blood pressure can also affect it. So you have to be seated or you lie down. Since you're doing it by yourself, sitting will be preferable so you can assess it properly. So this is how it is. Go this way. Now, you have to ensure that the tubing is on the side where you have an artery here, this way, like this. And also, ensure the tubing is not too tight so that when you inflate it, there will be space for you to have, for it to inflate. So once it's like this, a little space so that once you set it on, there will be place for it to inflate. So while you're done doing this, you just press this button. The middle button there is the on, and the reading begins. This is how it is. So don't bother, no matter the feeling on your arm, don't take it off. Just let it go through, and when it has gotten to the peak, it will start deflating on its own. That is why the electronics is preferable to the manual. So this is how it is. At the end, you get the reading. Now, if you look at the measurement I have here, there is 130, there is 93. 130 is the upper reading, which is known as the systolic. 193 is the lower reading, which is known as diastolic. So we already know the normal blood pressure measurement rate. If you don't know, you can check my previous video on hypertension. I have the normal blood pressure measurement rate there. So to interpret this reading, we are going to say the blood pressure reading is 130 over 93. You have the 130 up, you have the 93 down. So it is 130 over 93 millimeters mercury. That is the blood pressure reading for this particular measurement. Let me go through it again. The up one, which is 130, is the systolic, the upper reading. The 93, which is down one, is the diastolic. So if you want to interpret this blood pressure measurement, you say it is 130 over 93 millimeters mercury. Now there is a figure you have here. It is 103. That is the pulse rate. That is the pulse rate. So for this reading, we have 130 over 93 as the blood pressure reading and 103 as the pulse rate. On this other side, we have the red, the yellow, and the green. Once you have any figure that exceeds the yellow to the red, it means that it is very high. That is hypertension. And once you have anyone below the yellow, which is green, it means it's very low, which is hypotension, low blood pressure. So that is how to measure your blood pressure at home. Like I said, this reading may not be accurate for my blood pressure because I am standing. So if I'm seated, I will have a very different reading from this one. Remember, you cannot use one blood pressure reading to diagnose a particular condition. It is when you have done it on 2 or more occasions and you have same reading, that is when you can say you have high blood pressure or low blood pressure. Please, I want to advise or suggest, if after measuring your blood pressure at home and you discover it is either high or low, please and please, for the sake of your health, do not go to a chemist or a pharmacy. Rather, go to a hospital where the condition can be properly diagnosed, proper investigation done, and proper medication given. Do not self-medicate. This is the little I can share on how to measure your blood pressure at home. Please, if this video is nice or you enjoyed it, do well to share it to your friends, your family, and your well-wishers. And I also want to encourage you to get a blood pressure measurement equipment at home. It is not for you to instill fear in you, but for you to know your normal blood pressure measurement and how your health is going. Thank you very much. I remain your girl, Nurse Angie, on your favorite program, Let's Fix It. Thank you.